Good morning, everybody. Still time to say good morning. It's 10 to 12 now. Obviously, this is 10 minutes behind German time, what we have announced. But we have here, as the organizers, a hectic time behind us because we are still waiting for one of our opening plenary speakers. And to be a bit more flexible to accommodate him, we are starting a bit late. My name is Reinhard Busse. I'm the chair of this year's European Public Health Conference on the topic of strengthening health systems, improving population health, and being prepared for the unexpected. I will say a bit about the topic in a few minutes. But first of all, and this is why I want the doors shut, really, I mean, we are here in comfortable Berlin. We are in a nice conference center, good food, good weather, and other people in Europe, in our home continent, are facing a big public health crisis after 9 months now of war. So the first thing, please share with me a minute of silence to the people of Ukraine who suffer not only on their health, but in many respects. So please obey this 1 minute of silence with me. Okay, thank you. 1 minute already feels quite long, and they have been in war for 9 months. So I think just to put this into perspective. It's now my pleasure to announce the second part of this opening ceremony. And it's really we're in Europe, and we have our European anthem, so to say, the Ode to the Joy by Beethoven, and we long thought, how can we best present this? And we are really glad that we could get Nurit Stark playing her violin. Nurit studied at the Rubin Academy in Tel Aviv. She is also from Israel, but also in New York, in Cologne, and here at the University of Arts in Berlin. She's a regular guest on the European concert stage, for example, in the Philharmonie here in Berlin. She plays Petros Guarnerius violin dated from 1710, and besides Ode to the Joy, she will also play a piece from Bach. Nurit, you have the stage. Where is she? Thank you. Yes, thank you, Nurit. Thank you for showing your appreciation for this performance. And now we move into the boring content stuff after these two emotional highlights already. And I should say, I mean, I'm taking the, what did I press here now? Can you put this? I mean, many of you are not maybe aware of the rules of this game. We have a long fly-in period to prepare these conferences. So when we applied as the Berlin School of Public Health, and I represent the Berlin School of Public Health as a current speaker of the board of directors, this was before the pandemic. And then part of the application is, okay, what topic do you choose? And the topic, when you realize it, has three parts: strengthening health systems, basically to improve population health, improving population health. And then when the pandemic came, we added and being prepared for the unexpected. And in the next few minutes, I want to explain our thinking and the layout of the plenaries, and obviously also the rest of the program. We should start with health systems. And we all, I mean, in public health, some of us are a bit shy to use the word health system, and I know from meetings at WHO, it's always a question, what is the health system? Is it only the healthcare? Then you have the people who say, no, we have public health, we have health in all policies, and I have two definitions here. And you see, we have an arrangement of people, institutions, and resources. And to make it a health system, they have to come together in order with established policies. And the reason for being there as a health system is to improve the health of the population they serve, while responding to people's legitimate expectations and protecting them against the cost of ill health. And all activities qualify to be included in the health system with the primary intent is to improve health. which is maybe a bit different than some of the public health people in us feel, because we know that many other people, but many other actions, education, nutrition, and so on, also have an impact on public health, but it's not their primary intent to be healthy. Many of us probably know this graph from Thomas McCune 45 years ago, when he laid out that this is for those of you who don't know it, the falling mortality rate from tuberculosis in England. First thing is you realize how long they had statistics on causes of death in England. And he said, look at this, by the time when Robert Koch, not far from here, discovered the tuberculosis bacterium, it didn't have any impact on the decline of mortality than what he termed chemotherapy. So when we had streptomycin to treat tuberculosis again, even though you could say there was a corner there in the decline, then we had the vaccination. But he said, oh, healthcare doesn't have any impact on population health, so it's all the other things. But things have developed. First of all, our knowledge as public health professionals, public health people also interested in studying the effects of health systems have developed, and the health systems have developed. Clearly, we have seen masses of innovations, of progress in the last years. And so when we take Thomas McCune, our view would be like this. So when we look at population health, whether we measure it in terms of life expectancy, of disability-adjusted life years or whatever, that we have the biggies impacting on it. We have the environment, for example, climate and pollution. We have lifestyle risk factors. We have the socioeconomic status, including education, health literacy. They all impact on population health. But health care, in the view, and what many of us have learned when they studied public health at school, has no direct impact. But things have changed. So we now say, and this is the main topic here, to bring the public health people in us with the health system people among us together, that we now say, no, there is a certain part of population health which is amenable through a good health system. Through good health care, we know it can make a difference. So there is a green arrow here, at least to a certain part of public health. And the best known part of it is, and many of us know that now, that what we have first called amenable mortality, and then looking into more detail, that we can look at mortality which is preventable, and we can look at mortality which is treatable. So from conditions where we should not see premature death. If we had good health systems, both in the area of prevention, but also in the area of treatment, we could avoid these deaths here. These are the countries of the European Union. Germany is highlighted here in orange. We see the EU average marked in blue, and clearly the lower the amenable mortality rates are, the better. So we have certain countries on the top doing better. We have other countries at the bottom. And the question here is what determines that some countries are doing and some countries are doing better, some countries are doing worse. And we are here to discuss these things. And then the pandemic came, and clearly all of a sudden, even those people, not only among the public health community, but including the public health community, which had previously said there is little impact of healthcare on population health. I think many of us suddenly had interviews by journalists, what about intensive care in the pandemic? And some of us had to change really and realize that there is life outside the typical public health arena, that there is healthcare. And COVID-19 is probably a classic public health topic, with everything from vaccinations, detection, non-pharmaceutical measures, right down to intensive care. So we are looking now at the whole spectrum. And I think that's why we then said this is the time, really, our topic was well chosen, I would say, even before the pandemic, but by now we don't have to sell it to you anymore, that this is really important. And this topic then, so it's not a topic what many people think, it's not primarily on the effects of the pandemic. The pandemic has added certain aspects to it, but they are still the classical ones. If we want to have a good health system, there are certain questions to be answered. These are the questions which we'll be addressing in the plenaries to follow. So the 1 to 5 are the main questions asked in the plenary sessions. Can people afford to pay for healthcare? Because what good is it if we have a good health system and people cannot afford it and don't get the services? Can better data contribute to better healthcare? We will look at this by looking at the European health data space. How can we assess health systems' performance for policy? So how, given these differences in the performance of health systems, how do we measure that? How do we detect where we could do better? How can health services be reoriented towards health promotion to lower the need for healthcare to solve the problems? And last but not least, how can we improve training of the clinical and public health workforce to sustain high quality care? And I think the workforce issue has also become totally to the forefront. It was an important topic before, but we have now realized how crucial the workforce topic is for the public health. So this will determine our program here. And I should say we had in our original proposal also another topic, that is Europe's role in global health. I think we have also realized that it is one world. We are not in Europe separate from the rest, and the pandemic has also shown us so that how interwoven the world is, not only in respect to health, and we will also address this one in a minute. So this is the background to the topic. Obviously, there is a variety of other topics, and you find an hopefully very interesting, stimulating program. Please use the app and select what is most useful for you. With this, I now turn to our invited speakers who join here to join me with giving you some more background. And the first one on my list is our Minister of Health, Karl Lauterbach. Karl Lauterbach is actually a colleague of us. Before he really went full-time into politics. About 10 years ago, he was the chair at the University of Cologne for health economics and clinical epidemiology. And during the pandemic, as a then normal member of parliament, he became very famous because he was invited to many talk shows and explained to the people the pandemic. And then after the federal elections a year ago, I think he was maybe the first minister who was voted into office by popular pressure. There were so many people saying Karl for minister that he was appointed Minister of Health. He wished and had originally agreed to be here in person, but on the other hand, they have budget negotiations in parliament, and we have a parliamentary democracy, so he has to fight for his health budget there. But he has sent us a video speech, and with that, We should, without further ado, move to his video statement in which he greets you and explains a bit on the background of public health and public health pressures, changes in Germany. Please have the video.
Germany does not have a rich public health tradition to look back on. The pandemic made us painfully aware of this shortcoming, but we are already doing a great deal to redress this. I am therefore all the more pleased to be able to welcome the European Public Health Conference here in Berlin for the very first time. But before that, a few words on the situation that has overshadowed our continent since February 24th. Putin's barbaric war against the people of Ukraine constitutes a breach of civilization, and it targets all of us, the entire democratic rules-based world community. The German government stands with Ukraine. We will provide as much support as we can for as long as necessary. Going back to the challenges of public health, a strong public health system is indispensable for a resilient healthcare system. It means less susceptibility to crisis. It gives more people a chance to live a healthy life, and it creates a more financially sustainable healthcare system. Germany performs very efficiently in providing individual-level care, but there is room for improvement in public health. That is why at my ministry I set up a new Directorate General for Public Health, the first in the history of the Federal Ministry of Health. At the same time, we are strengthening the structures that deliver public health care. A key actor in this area in Germany is the Public Health Service. It is responsible for counseling and support opportunities for families with young children, school entry tests and other screening tests, drinking water and hospital hygiene, as well as protection against infection. In 2020, we agreed on a pact for public health service. We are investing a total of 4 billion euros in modernization, better equipment and more staff. We are also creating a new Federal Institute for Public Health. It will continue to coordinate activities in public health and network them with the Public Health Service. Last but not least, 1,000 health kiosks will be set up throughout Germany in socially deprived regions and neighborhoods. They will reach people who are not yet adequately served by our healthcare system. The years of the pandemic have taught us a lesson at all levels, nationally, but also and perhaps even more so at international level. The EU reacted quickly and strengthened emergency preparedness. With the package for a European Health Union and with the HERA Directorate General, which is short for Health Emergency Preparedness and Response Authority. The pandemic made us realize that we are all vulnerable, also when it comes to medical products and manufacture and supply chains. This is why we are aiming for greater diversification and strategic sovereignty. The crisis also revealed that we have a lot of catching up to do in providing digital healthcare. On the other hand, it also sped up the digitalization process. The European health data space is a major step forward towards data use in keeping with our values. Not market-driven, not controlled by surveillance state, but directed towards patients' well-being. My term chairing the G7 health ministers also focused on 3 important public health priorities. Together, we want to limit the impact of climate change, we want to protect the world from new pandemics, and we want to preserve the efficacy of antibiotics. Climate change is the mother of all problems, with its enormous consequences also for world health. At the same time, the health sector must also contribute to climate protection. As the G7 countries, we have undertaken to make our health systems climate neutral by 2050 at the very latest. The fact that we have to expect more pandemics in the future is also a consequence of climate change. With the Pact for Pandemic Readiness, we are strengthening the worldwide early warning systems for effective pandemic preparedness. More than 1 million people die every year as a result of the silent pandemic of antibiotic resistance. That is why the G7 will actively finance the research and development of urgently needed new antibiotics. Together, there is a great deal for us to do to make the healthcare system more sustainable, resilient, and efficient. But it is worth doing, and it can be done if we work together. This Congress can make an important contribution to achieving that goal.
Yes, thank you. That was our minister. Being in office since December, and believe me, he has a long agenda for him. I can say so. I'm a member of his government commission to look at the hospital sector reform, which is a big challenge in Germany. And there's lots to do besides all the other issues which he has mentioned, and which also adds up to the list, including this new public health office. Many of you will know we have the Robert Koch Institute, but there are other tasks in the long forgotten public health service which should be bundled in this new office. We now move to our second speaker here, and I said that we wanted to also address the global perspective on us in the European public health community. And I think there's no better speaker than Chikwe Ihegweatu, and because he is symbolizing what we as Europeans, in this case the German government, are trying to do to put more emphasis on global health. The previous German government said this is so important, the pandemic, being prepared for the next pandemic, that we opened together with the WHO in Geneva, the hub for pandemic and epidemic intelligence on September 1st last year. And Chikwe is the director. He's from Nigeria. He's a Nigerian epidemiologist. And before he moved here to Berlin, he was a director general of the Nigerian Centers for Disease Control. And so he brings his global perspective. Chikwe, it's an honor for us to have you here as a speaker at our opening plenary.
So, dear colleagues, friends, thank you very much for the invitation. It's already been such an inspiring opening. Even the minute of silence for Ukraine also reminds us of many similar crises around the world that happen every day and sometimes don't get the attention they deserve. So I hope that as sad as the situation is in Ukraine, we remember similar crises in Ethiopia, in Pakistan, to which we're all connected. Thank you. Rainer, thanks a lot for your kind introduction of the conference, of the purpose, of the themes you're going to address over the next few days. They've never been more important in our society. And this association and this conference has never been more timely. Also, the great words from the Minister of Health in Germany. He really has developed not only a voice for public health in Germany, but also globally. And it's very important that as we fight for public health issues in our society, we also learn to place public health at the center of the most important debates globally. And Karl Lauterbach has done that very well and showed leadership, and we hope he continues to do that for many years to come. I am personally really thrilled and honored to be here. My public health career actually started in 1999 at the Heinrich Heine University in Düsseldorf. And at that time, it wouldn't have been possible to do a conference like this with a hall full of people, with the diversity of attendees that I've seen already. So public health has really come far in Europe for us to have this. I also benefited by attending or being part of the 9th cohort of the European Program for Intervention Epidemiology Training, which I did in the UK when they were still part of the EU, but sent by Germany. So Germany really deserves a lot of credit for my career, and being back here in Berlin to lead the new hub is really a great opportunity. Now, to address the issues that we have to, moving forward, we have to also take some time to reflect on what has happened. And the lessons that we hope to learn. I try not to say that we have learned, but which we hope to learn from the pandemic. And really reflect on the costs, not only in lives. It's estimated, our estimates, the WHO's estimates, are that in the last 2 years, we lost over 14 million lives directly or indirectly to the pandemic. Very few other causes of anything we know can lead to so much loss of lives. But really the impact on the global economy and really on the economies of many countries around the world has really been profound and will lead to, is driving deep discussions now in every country around the world on how to react to that. But we have to also admit that the trajectory of the pandemic in many parts of the world did not go quite as expected. The countries that we expected the most affected were not necessarily the countries that were. The parts of the world that we assumed were least resilient turned out maybe not to be the case. So there are many questions that brings forward, and how much and what exactly we need to do. What are the investments? And they may not be self-evident that we need to build in order to have a resilient public health architecture to address the challenges, the threats of the future, known and unknown. And in the new WHO Hub for Pandemic and Epidemic Intelligence is one reaction to that. It's a reaction in recognizing that we have not been as good as we can be in using the data that is probably available to us already in helping manage, understand the risks and threats we face, understand our vulnerabilities, and understand how to address them. We haven't been as good as we can be with the resources available to us to build a surveillance infrastructure, to make use of the opportunities of digitalization, of IT, of the expertise, of the human resources, even in the countries where we have the resources to do so. So the challenge and the question then is, what is keeping us from doing this? We haven't, until recently, been in a position to make the best use of our genomics data, our surveillance data, our epidemiological data, not to talk about our clinical data. And the point was well made that we previously looked at the entire spectrum of clinical services as outside of public health. But it's not just the services. It's all the data collected by clinical services. And how do we, yes, keep our data, patient data, safe for the reasons that we all understand, but not diminish the importance of using that data to make big public health decisions. And it's only in doing that we can ultimately get to where we need to get to, which is basically how do we make better decisions? Better decisions in times of peace, better decisions in times of crisis, better decisions at all levels of governance. So in doing this, in preparing ourselves to do this better, we're really grateful for the government of Germany in supporting the World Health Organization and really the courage it took to do this in the middle of the pandemic and saying, listen, we're going to lean into one of our biggest challenges and invest in this and show the leadership and put forward the resources and give WHO the authority, the flexibility to come forward and advise on how to do this and actually move forward on it. And it's with that huge responsibility that we're building up this team here in Berlin at the moment. We're also grateful for our foundational partners because we're not doing this alone. And it's not by chance that this is in Berlin, but really working with some great German institutions, the Charité, the Robert Koch Institute, as our foundational partners in building together a local coalition, building on the startup architecture in Berlin, the digitalization effort and spirit, the entrepreneurial spirit in Berlin, leveraging on all of these to come in and support us in the work that we're doing. But we're also working with the great European institutions that exist already. The European Center for Disease Control and its very worldwide recognized strengths in risk assessment, and the new agency, HERA, that has just been announced, Welcome in the UK, and many other great institutions that already exist that enable us the opportunity not to necessarily need to start from scratch. So what exactly is this hub? I'm sure it's a question you're asking. Many people think about it as a hub that will suck in data from countries around the world, somehow analyze it, and present answers to the questions that we have. But anyone that is working intensively in public health knows that we are far from there. Even if we wanted to share data today between two of the friendliest countries in Europe, and you can take your pick, at the moment, there is no mechanism to do that. Because very often when we think about sharing, we very often default to the reasons why countries don't share, and default to thinking about countries for whatever political, social, or security reason we imagine may not want to share. But let's leave aside that for a minute and imagine the two friendliest countries in Europe. And imagine if they wanted to share data that they thought was important for public health decisions. At the moment, we simply don't have the technology, the architecture, the governance to share. So one of the first things we're trying to do is build up that. Try and work with countries not to send their data to us, but to develop the capabilities to collect, analyze, and use their own data better for making decisions. And agree on norms and standards, on methods and technology, agree on governance in countries, and then think about sharing at a later point as a collateral benefit of what countries are able to do for themselves. To do this, the technology exists already in many other sectors. The governance exists in many other sectors, and many other sectors have come together and decided, listen, because there's a global system that requires global collaboration, we will develop a governance infrastructure that allows national autonomy, but still enables us to share that which is necessary for us to keep a global system working. Because it is in our own mutual interest to share a certain amount of what we collect, whether it's data or insights from that data, in order for us to keep the world safe in different domains. And this happens every day in the security landscape, in the financial landscape sectors, in the aviation industry. In almost every industry, they have developed a framework with which to share because they understand the common benefit to humanity for them to do so. We haven't done that in public health. And that is one of the areas of conversation that we are beginning to push. And quietly, we are winning over hearts and minds that this is an important area to focus on. But hearts and minds are not enough. We have to develop the tools, agree on the tools, agree on interoperability in many spaces, bring together many sectors that have not traditionally worked together in our community. We've realized that epidemiologists are not enough. We really have to understand and develop the area of data science, in behavioral science, social scientists, environmentalists, colleagues working on the animal-human interface, and so that the minister is happy with what I say, include a few virologists in that discussion as well. So the hub we're building in Berlin is a hub in Berlin. It's leveraging on the capabilities in Berlin and Germany, but really is a hub for the world. So right now, we're recruiting and putting together the team that will work on this and drive a lot of these efforts moving forward. On the global stage, at the last World Health Assembly in May, our Director General put up 10 proposals to make the world a better place, redesigning the global health preparedness and response architecture. Within that are 5 interconnected subsystems. And they include the first one, collaborative surveillance, which we're leading on at the moment. Then we have access to countermeasures, really thinking about the spectrum of countermeasures from vaccines, treatments, diagnostics, to basics like personal protective equipment, to clinical care and integrating clinical care into a broader thinking around health protection, to access to community countermeasures, all the public health and social measures, and providing a real framework to use them. And the final C is around coordination. Now, on the collaborative surveillance subsystem that we are leading on from the hub, we see 2 kind of areas of importance in 2 dimensions. One, like I've said earlier, is on building up our capabilities, our capacity in this space. But the other area that we're going to focus intentionally on is on the collaborative axis. And so in assessing our own capabilities, we're not only going to assess the capabilities that we have. When I say we, I refer to every country and every region, but how good we are at sharing those capabilities and collaborating along those capabilities. Because if we're not able to collaborate, then we cannot really address global problems like pandemics. So we have to be more intentional in building into our work the collaborative component, and that really is the fundamental basis of the new network being built out here in Berlin. And we're thinking about this around, 1, pathogens, and the work, the acceleration of work around genomics has happened so quickly that we haven't really sufficiently put into place the framework with which to share that data, how to collect that data, what is the associated epidemiological or clinical data that we need to collect, and how do we share this? So platforms have been developed, but the principles of sharing not fully agreed. So in the next few days, you will see a new document that has taken literally months to agree on the principles of sharing genomics data. That is the first example of a globally consulted agreement on how to share genomics data for public health. And it defines the principles of sharing, the reasons, the variables that need to be collected, and how and why, and so that every country can then reflect on that and use that as the basis. But we need to go beyond genomics to think about the same thing for our health, our public health, epidemiological, and clinical data, but also, critically, the contextual data. How do we collect and integrate migration data, behavioral data, treatment consumption data, all of which we know how to do in small pockets and in research groups, but we have never done consistently from a public health perspective over time. So I'll start concluding by identifying a sweet spot. This sweet spot is not really in the collection. It's in the intersections. And to bring together the intersections, the data on migration, on air travel, on movement, on social behaviors, is not necessarily a technical problem. It's whether we can work together and pull the individuals together. So when you come to a public health institution, you just don't see only epidemiologists. You see social scientists, you see environmentalists, you see virologists working together, thinking together. And that is exactly the collaborative space that we're building up in the new hub in Berlin. So that in thinking about the solutions to the problems that have become so self-evident through the pandemic, that thinking is not limited to the groups and professional categories of individuals that have been used to thinking about these problems in the past. But we are forcing people together. Forcing is not the right word, but bringing people together in a collaborative space, literally and figuratively. Our offices will be a very collaborative space, but also it is symbolic of a new way of working that we think is necessary to create the alliances and the collaboration that we need to keep the world safe. So to conclude, this cannot be business as usual. We have to take bold decisions in moving forward. We cannot respond to the future the way we have responded to the past. We have to get better at working together. And the new hub in Berlin really signifies the opportunity that we have, the new direction that we have to go, and the work that will hopefully enable a safer world. And I hope that in many years' time, we can collectively celebrate in one of your future conferences the events and the new institution that was set up in Germany in 2021, and come back with a few results of how really it has impacted our world, our profession, and the work that you all do every day. So thank you very much for the opportunity. I'm very grateful and look forward to the rest of the conference. Thank you.
Thank you.
Thank you, Reinhard.
You see me in a very difficult position. You know that there should have been a third speaker, Hans Kluge, the regional director of the WHO Regional Office for Europe. He's just arriving, but I now had to make a very difficult decision whether to overdraw this plenary or to start the other one, the next one, a bit early. We decided for the second one, so we close this session here. Please, those of you who go for the lunch sessions, grab your lunch and be quick, because we will start back here 5 minutes earlier than announced in the program. 13:45, we re-meet here, and before we then go into the topic of the financing, we have the speech by Hans Kluge. See you back then here in this room. Thank you.